Now, to tell us more about their efforts to fight another COVID-19 case surge, we have with us on the line Joel Garganera. He is head of Cebu City's Emergency Operations Center. Mr. Garganera, welcome to the big story.
Yeah, good evening po.
Good evening po. You heard the DOH Region 7 saying this could be local, this could be community transmission of Delta variant. But what are all the other factors that could be contributing and driving this current surge in Cebu?
Well, as early as June, when we realized that there is an increase in the number of cases on a daily basis, kami dito sa Emergency Operations Center, we assume already that it's Delta variant because yung mga kaso namin, it's really spread out, no? It's really spread out. And then yung age, it really knows no age bracket, no? So, yun nga, yung sinabi nga ni Dr. Dean Ureche, na it's been like over almost a year nag-MGCQ kami. And then it seems like people start to feel and act normally. And then until this one, well, recently, yung second surge namin, yung February, March, at saka April, we have more cases compared to the first surge. No, we have around 11,000 cases compared to last year 8,000. But yung difference is yung last year, yung 3 months, it cost us 672 deaths. No, unlike yung sa second surge, we might have like more than 4,000 cases, but yung deaths namin, we just limited it to 162. No, because we know already the variant, the virus, so the frontliners know already how to treat it, and yung mga tao naman very cooperative. But just recently, this third surge namin, talagang mabilis, and then it's the type of patient that arrive in the hospital na they easily deteriorate, no? Nagpag-progress din yung case nila 2 to 3 days. Unlike nung una, it will reach something like 7 to 10 days, no, before lumala yung kaso. But right now, yun nga, border control natin, medyo lax na. And then yung mga tao, yung behavior nila parang normal na. So it took a while for us to revert back to where we are, where we should be before. No? So yun ang mga nangyari.
In the meantime, Mr. Garganera, kamusta po on the other side of the situation? How is the capacity and the capability of our frontliners and the public health sector in general in Cebu to deal with the surge?
Yeah, it's really a challenge. You know what? In Cebu City, 182, just for today, 182 frontliners, yung mga doctors, nurses, medtech, yung lahat, no, got positive, no, for the last 14 days, no, 182. Alam mo naman yung 182, these are spread out into 23 facilities, no, laboratories. So yun lang, it's very hard, no, because yung 182 yung nag-positive, hindi pa yung na-expose sa kanila. So it really created a big dent in the operation of the different facilities. And yes, the DOH and of course the Cebu City government, we are into recruitment, but unfortunately, very few, no, took the challenge, no. Like it's really a challenge for us to recruit more nurses. Yes, we have around 72% yung occupancy namin sa aming COVID ward, but then the remaining 20 plus, it's not because na they are not yet occupied. Yes, the beds are there, but we have no medical personnel to man them. So it's really a challenge. In fact, there are some hospitals as we speak right now, patients are still lining up outside. And just today, Red Cross arrived, and then we're going to put up some tents, yung modern tent nila with aircon and everything. So we're going to put up around 6 of them in the different hospitals, and that could also augment the conditions of those patients that are outside the emergency room. It's really a challenge. It's really a challenge, and our hospitals are really overwhelmed. But I could see our frontliners are really moving heaven and earth to attend to the patient. Then, So we just pray that everything will subside in the coming days ahead.
Okay. Maraming salamat po, Mr. Joel Garganera. He is head of Cebu City's Emergency Operations Center.